Welcome to Biztech's Health and Wellness Show, where we focus on equipping you with knowledge on health and wellness to help you to ensure a more productive and healthy life for yourselves, your families, and your employees. Now, the conversation today is about keeping colon cancer risk at bay. Now, this presenting and content partnership is with KPJ Ampang Puteri Specialist Hospital. Now, to bring an expert lens to this topic, we have Dr. Hamizah Razlan, consultant gastroenterologist and physician at KPJ Ampang Puteri Specialist Hospital. Now, Dr. Hamizah, welcome to the show.
Hi, Brian. Thank you for giving me an opportunity here to speak on the topic.
Now, Dr. Hamizah, before we start, let's get to know you a little better. Could you tell us a little bit about yourself, what you do, and also your training?
Okay, I'm a consultant physician and gastroenterologist. Okay, so I graduated from Glasgow University, and this was quite some time ago, in 1997. So after I finished my graduation there, I worked for a year in UK before coming back to Malaysia. And once I'm back in Malaysia, I underwent the master program in UKM. So, and once I became a specialist there, I actually served the government hospital there in HUKM for 15 years before I actually left, and now I'm in my private practice, going to my 7th year in KPJ Ampang Puteri.
Now, Dr. Hamizah, what made you become a doctor and why did you choose this specialty?
Well, that's a long time ago. I think I've always been interested in medicine. Since I was in school. So science was my forte and I used to like it. I was fortunate to excel in science, so I continued doing. I had the interest in doing this for no specific reason apart from being just very interested in the subject from very young, and no regrets. I'm really enjoying doing medicine, and I chose gastroenterology. I think because when I was training in the medical school in UK, I think I just got interested in doing bit of both procedures and also being a physician, because in gastroenterology you are allowed to treat patients like physicians, and we all do, but we can also do our procedures like endoscopy. We can do interventional work, and this interested me because we can do a bit of both in the field of gastroenterology, which has evolved and we have done so many new things that can be done through endoscopy for intervention.
Now, I want to start by for you to give us some sort of definition, because we hear about colon cancer, colorectal cancer. Are these or different names for the same cancers, or are each a distinct type? Could you kind of enlighten us on this?
Okay. Well, colorectal cancer is also known as colon cancer or bowel cancer, and sometimes people call it rectal cancer. Actually, we mean the same thing. Is cancer actually occurring in the large intestine, the large bowel, which is can include the rectal area. So it actually means the same thing, right? So some people, this is a synonymous term.
Okay. Now, how prevalent is it in Malaysia?
Oh, it's the latest statistics have shown that it's actually very, very prevalent in Malaysia now, where it's actually the second commonest cancer among males and also females. And also the third commonest cause of death among Malaysians, among the cancer deaths. So the incidence have risen a lot throughout the years, and very, very common now in Malaysia.
Okay, so give us some perspectives on what are the risk factors that come to play when we talk about colorectal cancer.
Okay. Usually colon cancer is more common as we grow older. And it can occur in young adults, but it's more common above the age of 50. So we're talking about risk factors. So the risk factors here will be age, okay? And normally we do have a cutoff point about 50 and above, okay? Number two, patients who may have underlying bowel problems such as inflammatory bowel disease. If patients have this, they have a higher risk of getting colon cancer compared to the general population. Another group which is susceptible to getting cancers will be patients with strong family history of colon cancer. this we mean by first degree relatives. We're talking about parents, sibling, or child having colon cancer, then there's increased risk in the family. A small proportion of these cancers arise from some genetic disorders of the bowel. Here is inherited forms of colonic polyps. And these, they form less than 5% of cases though. There are not many of these.
Okay.
Also to note that there are also other risk factors which can be, other factors that increase the risk of this, which includes lifestyle factors. And here I mean patients who are overweight or obese, okay, they are increased risk of getting colon cancer. Patients with sedentary lifestyle or physical inactivity. And there are some dietary factors that have been implicated in the pathogenesis of colon cancer. For example, patients who actually take too much red meat, processed meat, and low in fiber, like fruits and vegetables.
Okay.
And last but not least, is also being implicated in patients who are smoke too much or drink too much alcohol.
Dr. Hamizah, what sort of symptoms should we watch out for colon cancer, and are they the same for men and women?
The symptoms are the same for both men and women. Okay, and the symptoms which will include changes in bowel habits. Okay. Here we mean by if a patient has a consistent pattern of bowel movement, any change in their normal routine. That's what we're looking for. That's what we mean by change in bowel movements. Any appearance of blood in their stools. If they notice fresh bleeding, that is what we call alarming symptom. If they are losing appetite and losing weight unintentionally, so that's another alarming symptom. So patients may also come and complain about a new development of abdominal pain or discomfort. And sometimes I've seen patients who just come in with feeling unwell, just lethargic or fatigue. And this can happen if they've been having symptoms of anemia, which is another symptom or sign of possible underlying colon cancer.
Now, could you help us to understand then, so that we could recognize it either within ourselves or within our loved ones or friends and family? What are the various stages of cancer, for colon cancer?
Okay, cancer, roughly we can just say, just make it very simple. Okay, if the stages of colon cancer can be, if it's in stage 0 or 1, where it's actually just confined to the lining of the colon. Okay, stage 2, where it's actually gone through the lining of the colon. And stage 3, where it's actually spread into the structures surrounding the colon. And stage 4, where it's spread everywhere. So depending on the stages of these, the patient may present differently.
Given the various stages, what are the treatment options open to patients?
Okay, if the cancer is detected in the early stages, okay, we mean by maybe stage 0, 1, where the cancer is confined, in the bowel itself, the treatment option is surgery. Okay. And surgery is actually curable. They actually remove the colon cancer, and the patient may not need, in these early stages, any more treatment, further treatment such as chemotherapy, radiotherapy, etc. Unfortunately, if it is more advanced, stages 3, 4, the patient then needs a combination therapy with surgery and further treatment with chemotherapy, targeted therapy, plus minus radiotherapy. So these are the options available for them.
Okay, so given your specialty, I'm sure that a facility like KPJ Ampang Puteri would take a very multidisciplinary approach, not only from a treatment standpoint, but also from a support standpoint for the patients and their loved ones. Could you sort of give us an overview of some of the things that you do for the patients during these difficult periods?
Of course, yeah. If the patient comes to me and then we've done the procedure and we found that the patient is indeed having colon cancer, so first thing we'll do is we stage the disease and tell them what's the options available. And the multidisciplinary that you're mentioning here will involve the surgeon. Okay, so if it's treatable by surgery, the referral will be made to our colorectal surgeon. And after the surgery is done, if it's the stages I mentioned earlier, in the early stages, then the patient doesn't need any more further interventions such as chemo or radiotherapy. But in case the patient has advanced stages and they need further intervention, we will call our oncologists to come on board as well. And the oncologist will come and see the patient and offer chemotherapy, targeted therapy, radiotherapy. It all depends on the location, size of the tumor, and the stage of the cancer. And of course, with all this, the patient will have their mental stress because of accepting this bad news, trying to get used to this. So for support from that part of view, we obviously provide counseling services to them as well if they need support in these difficult times. Some of them may have difficulty accepting this diagnosis and dealing with this sickness, and we always explain to them that we're here for them, and if they need any extra counseling services, etc., the hospital has both psychiatrists and also psychologists to help them through this difficult period.
Now, if it's a more advanced stage, is there an element of palliative care involved as well? Because palliative care is relatively new in Malaysia, but it's gaining in popularity because the benefits are quite apparent. Could you shed some light into that as well?
Okay. Yes, for those with advanced stages, so the main therapy then is to keep them comfortable. And yes, palliative care is very important during this terminal care stage. So we have the nursing support that can help them. Here we mean palliative therapy means feeding, giving them medication to keep them comfortable. And then we work closely with Hospice Malaysia. If there's anything, we refer them on. And Hospice Malaysia will provide them with any equipment they need. And if the patients then decide to go home to their homes, we have our own nursing, or we help them get outside nursing services to help them cope with this terminal care. We don't actually have palliative care specialists in this hospital per se, but we do have the other support that we have to help these patients cope in the hospital and also when they go home to their homes.
Now, Dr. Hamizah, I think one of the key things is when you mentioned the sources of colon cancer, lifestyle has a lot to do with this. What are some of the things that we can do to, one, prevent this from happening in the first place, and two, also reduce the risk of colon cancer?
I think very important here to take back here is that colon cancer is preventable. As you mentioned earlier, the risks of what we call the risks that are which we cannot change, and the risks which we can change, which is our lifestyle. So the first thing is, I think all of us have to maintain a healthy weight. So if you're overweight, if anybody's overweight or obese, the first thing we have to do is try to reduce the weight and maintain a healthy BMI. That's the first thing. Number two is to have good physical activity, physical fitness. Do regular exercise, 3-4 times a week, as much as you can. Spend 20 minutes, 30 minutes, do moderate level exercise if possible. And of course, the food we eat, we should maintain a healthy diet. We should start looking at eating more fiber, fruits and fiber, eating less processed food, processed meat, which has been implicated in their pathogenesis, etiology of this cancer. Okay? Of course, limit the alcohol consumption, limit the smoking, and last but not least, if you have reached the age of 50, come for screening colonoscopy. So just to share to the audience that we have screening procedures available to detect this early. So what we normally do in this hospital is, and I'm sure in a lot of other centers, is to do what we call colon cancer screening, which usually starts from the age of 50 and above. Okay, here patients who are asymptomatic but should come forward to do a colonoscopy, where we actually insert a long narrow tube through the back passage and into the large intestine. And what we're doing is actually looking for small growths called polyps. And these polyps are actually benign growths. They line the colon and the rectal area. And these polyps, with time, some of these polyps can change into cancerous growth. And so the purpose of doing the colonoscopy is actually to look for these polyps, remove them early, preventing them changing into a cancerous growth with time.
And if we do that early, obviously there's prevention rather than curative.
Yes.
Is that a surgical procedure in itself?
No, it's actually, in a way, it's an endoscopic procedure. We do it during the colonoscopy. And if the patient is found to have a polyp, we will remove the polyp through a biopsy. And if we have our procedures where we can actually remove the polyp safely. So they don't really have to go to surgery to remove this.
Okay, and that's food for thought, because when the statistics say that 90% of patients are above 50 years old, it makes you start to wonder that, hey, you really need to go and do some screening after the age of 50.
Yes.
And in terms of frequency, probably, how often should we go and get ourselves screened?
I think the guideline was saying that once you've done a screening, and if you're clear of any polyps, they used to say every 10 years.
Okay.
I tell my patients come back 5 to 10 years. Sometimes they say 10 years, wow, it's too long. Anything can happen. I say, yeah. So you come back maybe 5 to 10 years. But if you're found to have any polyps, that's a different story. We see what the type of polyp it is. We remove the polyp, we send it to the lab, and then we will tell the patient, you may have to come back earlier. So these depend on the type of polyp. So sometimes they come back in 3 to 5 years, they come back for the screening.
Now, Dr. Hamizah, it's been a fascinating conversation. I learned a lot. But before you leave us, could you share with any final thoughts you'd like to share with us before we end the conversation?
I think just to highlight that March is our colon cancer awareness month. And colon cancer is very high in Malaysia. And I think people should be aware that it is a curable cancer if it's detected early. And prevention is obviously important. And by doing screening early, we're actually preventing this from happening. So I think that's my take-home message.
Thank you very much, Dr. Hamizah, for coming on the show.
Okay, thank you, Brian. Thank you.
I'm Brian Fernandez, and we've been speaking to Dr. Hamizah Razlan, a consultant gastroenterologist and physician at KPJ Ampang Puteri Specialist Hospital, on Biztech's Health and Wellness Show, presented by KPJ Ampang Puteri Specialist Hospital. This video and podcast will be on our website, www.biztech.asia, as well as our various social media platforms and KPJ Ampang Puteri's social media platforms as well. Please subscribe and like our various platforms. Thank you very much for tuning in.